Go.
Hand hygiene. I'm going to pull the curtain for privacy. I'm going to assess my room for any safety issues with our exam. Hi, good afternoon. My name is Sarah. I'm going to be your nurse today. I'm going to be doing a health assessment. Shouldn't take too long. Just let me know if you have any questions throughout the process. Can you verify your name and date of birth for me? Check with your armband.
2161.
Okay, so at this time I would take your vitals, your blood pressure, your pulse, your temperature, your respirations, your oxygen saturation, and then your pain on a scale of 0 to 10. Okay, are you having, so she's conscious and alert, oriented to person. Do you know where you are right now?
Hospital.
And do you know what day of the week it is?
Wednesday.
Okay, so she's alert and oriented times 3. Not in any apparent distress. Nutritional status looks appropriate. She appears to be well groomed and dressed appropriate for the weather and situation. Her mood is cooperative and alert and pleasant. Doesn't appear to have any gross deformities or injuries. And like I said, no distress. She has ease of motion in the bed and ease with speaking. Are you having any vision changes or hearing changes?
No.
Okay, so I'm gonna assess her head. It looks normal cephalic. Eyes look symmetrical, ears look symmetrical. There's no deviation of the nose. Trachea looks midline, no apparent enlargement of the thyroid gland or neck. Okay, so can you open your mouth for me? I'll use my tongue depressor and hold it down. Can you stick out your tongue for me? Can you stick out your tongue for me? And then can you say ah? Okay, teeth look intact. There's no issues, no lesions, no bumps of the tongue. Her oral mucosa is pink and moist, and then airway is patent. Can you clench, so that is cranial nerves 9, 10, and 12 are intact. Can you clench your teeth for me? Okay, cranial nerve 5 is intact. Can you smile for me? Can you frown for me? Can you puff out your cheeks? Raise your eyebrows and then purse your lips. Okay, cranial nerve 7 is intact. Can you shrug your shoulders for me? Cranial nerve 11 is intact. And then can you just stare at something in the distance? Okay. All right, eyes are perla. Can you, without moving your head, follow my finger with your eyes? Okay. Extraocular movements are intact, and the 6 cardinal fields of gaze is intact. So cranial nerves 3, 4, and 6 are intact. I'm going to defer cranial nerves 1, 2, and 8. Okay, are you having any difficulty breathing or pain with breathing at this time? Okay, assessing the anterior and posterior of her. I do not see any issues or deformities with her chest. I'm going to auscultate the back. Okay. Take a deep breath. Deep breath. Deep breath. So she has ease of motion while breathing, does not appear to be any distress while breathing. Lungs were clear and equal bilaterally, no abnormal breath sounds. To listen for abnormal breath sounds, I would listen for the bronchial breath sounds, which would be over the trachea. The bronchiovesicular would be the anterior sternal border, and then the vesicular would be the posterior spinal border. Can you turn this way for me? Can you repeat the words 99?
99.
99?
99. 99.
One more time.
99.
Okay. Okay, so tactile firmitis. I felt normal vibrations bilaterally across the back. In percussion, I felt tympanic resonance bilaterally throughout the back. Okay, so are you having any chest pain right now?
No.
Okay, I'm going to listen to your heart. Well, First, I'm going to assess your precordium. I do not see any apparent palpations. I'm going to place my hand right here. I do not feel any thrill. Okay, and I'm going to listen to your apical pulse. Okay, steady and regular. Okay, so I listen to the aortic valve, which is the right chest wall, second intercostal space, S2 is greater than S1. The pulmonic valve, which is on the left chest, second intercostal space, S2 is greater than S1. The Erb's point, which is the third intercostal space on the left chest, S2 equals S1. Tricuspid valve, which is on the left chest, the fourth intercostal space, S1 is greater than S2. And then a mitral valve on the left, midclavicular left chest, fifth intercostal space, S1 is greater than S2. Okay, I'm going to feel for your pulses. I'm going to feel for the temporal pulse, the carotid pulse, brachial, radial. I'm going to defer the femoral pulse. I would lift up your pants and feel for the popliteal pulse. Feel for the dorsal pedalis pulse and the posterior tibialis pulse. I'm going to check cap refill and check cap refill. Okay, skin is warm, pink, and dry. No signs of edema on the hands or legs. Okay, next I'm going to have you lie back for me, lie flat. I'm going to assess the abdomen. Appears round, non-distended, smooth, no apparent striae or scarring. I'm going to listen. Okay, so their bowel sounds are active in each quadrant. I also listen to the abdominal aorta. No evidence of abdominal bruit. I'm going to percuss. Okay, I felt tympanic resonance in each quadrant. I'm also going to palpate. Are you experiencing any pain?
No.
Okay, no pain. Abdomen is soft and non-distended, non-tender. I'm going to palpate the bladder. Any pain?
No.
Okay, bladder is non-distended. If she had a Foley, I would assess, or a urine sample, I would assess for color, consistency, amount, and clarity. Are you having any difficulty urination, with urination, pain, frequency? Okay. So I'm going to have you raise your right leg, raise your left leg, raise both at the same time for me. All right, can you bend your knee? Bend your knee. Okay, I'm going to, any pain with this?
No.
Pain. Any pain? Pain. No. All right, push on my hands for me, pull on my hands. All right, are you having any pain?
No.
Okay. Can you sit on the side of the bed for me? All right, can you lower your head to your chin? Can you go in circles? Arms out, round, above your head, behind your back, and then behind your neck. Put your arms out for me, bend them, lower them, hands up and down, and around, and then, okay. Can you, with your arms up like this, can you pull? Can you push? With your hands, can you push down, pull up? Okay, squeeze my fingers for me. Okay, so she has full range of motion in all extremities, flexion, extension, supination, pronation, external and internal rotation of the hips are all intact, for ease and no pain during. She has appropriate strength in all extremities. And, okay, can you stand up for me? Can you touch my finger and then touch your nose? Okay, and then with the other hand. Okay, and then closing your eyes, can you touch your nose with one hand, other hand, and then both back and forth? Okay. Can you just keep your eyes closed and stand still for a second? For about 20 seconds, I would assess her Romberg and balance. Appears to be intact. Can you take a couple steps forward for me? All right, and then on your way back, can you walk heel to toe? Okay, gait seems appropriate. Balance seems appropriate. As I said, all within normal limits. Okay, can you have a seat for me again? So throughout this assessment, I was assessing your skin, as I said, warm, pink, and dry. Are you having any, are you having any muscle pain or weakness?
No.
Any joint pain?
No.
Any changes? Okay. And then, are you having any skin issues like rashes,
No.
dryness, redness, swelling? No? Okay. Throughout the body and all the extremities, I did not see any redness and swelling. No evidence of edema on the arms and legs. Okay, so you can lie back for me. I would put her in a position of comfort, put the sheets up, call bell in place. The bed would be in the lowest position. All of her belongings would be close to her. I'd make sure it's a safe environment for me to leave. Do you have any questions?
No.
Okay, so I would open the curtain for privacy or do my hand hygiene. I would gather my equipment, clean my equipment, and then document my findings.